5 years ago, COVID-19 was first reported in China's Wuhan, and years later, the question still remains if the world is ready for another pandemic. The ongoing spread of a novel bird flu strain, specifically the H5N1, is causing alarm among public and animal health officials across the United States as it continues to infect various species. Now, the spread of the strain has raised concerns that the virus could mutate into a form transmissible between humans, potentially triggering a pandemic which could bring the world to a halt in a similar way that it did years ago when COVID-19 surfaced and wreaked havoc. The National Public Health Agency of the US reportedly found bird flu mutations in a patient in Louisiana. The CDC said in a statement that the Louisiana case of bird flu marks the first instance of severe illness that's linked to the virus within the US as the situation evolves. The agricultural and health communities remain on high alert, working to mitigate the impact of this potentially devastating virus. The recent detection of H5N1 in non-commercial pigs on a farm in Oregon, US marks a significant development in the virus spread. Recently, the CDC announced on the 18th of December the first severe case of H5N1 in the US. That patient had been exposed to sick and diseased birds in backyard flocks, whereas a notable case of a child in California marks the first reported instance of H5N1 in a US minor. Meanwhile, the National Public Health Agency of the US has reported that the current risk of individual and population health remains low and has not significantly changed from the most recent assessment done on a similar H5N1 virus that caused an outbreak among mink in 2023 in Spain. The CDC continues to emphasize the importance of stringent biosecurity measures to manage the spread of H5N1. These include enhanced surveillance, immediate culling of infected stocks, and ongoing public health advisories to limit human exposure to virus.